I'm Robert Skinner with the UN Foundation, going from Jordan, bringing it back here to New York. And I'm so pleased to introduce our next conversation, To Be Counted. Please welcome Laverne Cox, actress and advocate, Shelby Chestnut, co-director, community organizing and public advocacy at the NYC Anti-Violence Project, and Cecilia Chung, senior strategist for Transgender Law Center. Give them a good round of applause.
All righty. Thank you. Thank you so much, everyone. I am so excited and honored to be here to talk with you today about data collection and transgender folks. I know that's a really exciting topic, right? Data collection. And I'm so excited to be joined by these two amazing folks. In June of 2014, when I was on the cover of Time magazine, the headline read, "The Transgender Tipping Point." And since then, I've read many articles and heard from many trans folks who question this idea of a trans tipping point. Most notably, Teek Milan, in his keynote address at the Trans 100 this year, talked about the importance of visibility, which is really what we've seen over the past couple of years for trans folks, an unprecedented media visibility for trans folks. But during that time, so many transgender lives have been lost. So many transgender people still experience discrimination at disproportionate rates. And so I was thinking that this visibility is only part of the equation. We must have social policy, systemic change as well. And I thought about the census. I thought that systemically, this idea of the gender binary model is very much sort of institutionalized in the fact that we just don't count trans people. We don't actually have accurate numbers in the United States and around the world of how many trans folks actually exist. So I would love to begin a discussion about how do we start doing data collection for trans people and creating a political will for that, and getting people excited about asking gender identity questions. And so I wanted to have this conversation with Shelby and Cecilia. And Shelby, in your work at the Anti-Violence Project in New York City, can you talk to me a little bit about the importance of data collection and the limitations that we are experiencing now with what we have?
Yeah, so in working with LGBT survivors through our national coalition of anti-violence programs, this year alone we've reported 19 homicides of transgender and gender nonconforming people. And of those, 17 were trans women of color. And I think for years, you've been saying that this is a state of emergency against trans people, particularly trans people of color, the violence that they're experiencing. And it really is now that we need to be having this conversation. And while our reports that we release through our national work are really important, cutting edge, we are really the only body that's collecting data on the victimization of LGBT people, specifically transgender people in the country, talking about the violence that they're experiencing. But because we're a nonprofit, we're a coalition, there's no government requirements that are saying we need to count trans people to get to a real sense of the victimization of transgender people. So 19, yes, it's a horrific number, and we need to be discussing that and the systemic issues connected to that. It's a glimpse of what we've known to exist for much longer than just the last couple of years when it's come into the media.
I always think it's important to know too, when we always talk about these numbers, we say that we know of, because we understand that far too often when these murders are reported, that transgender people are misgendered. And I think that again goes to this thing of transgender people not being counted, where we don't actually have, and I think there's a lot of issues around counting trans people. Trans people have to feel safe to identify as trans. In India, they've just recently started counting trans people. And really, India and Nepal, they've recently started attempting to count transgender people. But a lot of, I think it's 30 trans people in India are 30 times more illiterate than the rest of the population, they discovered. And so when they were doing the data collection, people were interviewing these trans folks, and a lot of trans folks didn't feel comfortable identifying as trans in a society that deeply stigmatizes that identity. Do you want to add something else?
Well, I think too, if we really do push the census data collection or crime victimization data, we'll see the systemic issues that trans folks are facing. Housing discrimination, underemployment or employment discrimination, lack of access to education that's affirming, in elementary school, K through 12, all the way through college. We're dealing with folks in extreme poverty, and it's the only way, data collection is the only way that we get to be able to actually address the systemic poverty that ultimately is resulting in violence. And if we had solutions to that and initiatives were being funded to support trans people in affirming ways, we might start being able to address the violence that is literally killing trans folks every single day.
It's really important to note the connection there. I want to highlight the connection to funding and data collection. That when we were talking about the goals, the global goals here, for the next 15 to 20 years. And so many of those global goals, there's money attached to that. And if are trans people going to be included in that? We're not going to be if we don't actually take the data. And what I loved about, I reached out to Cecilia earlier this year to have this conversation, and she proposed this four-pronged approach to data collection for transgender people. Can you talk to me a little bit about that?
Yeah, I think that that's really important to look at how we as a country allocate resources. And usually it's like through census that happens one every 10 years, so that they know, what income that people are making and, and what the household size, men or women, but there are a lot of questions that we wish they were asking, but it's not in there. One, of course, is gender identity, and the other is, sexual orientation.
Yes.
So there has been a big push since 2010 to really have those two questions include. That's the government, doing a wide counting of its citizens, and its constitution required us to do that. So we can't get away from that, because of these change. We really need to make sure that the Bureau of Census are starting to be more cognizant of it and start to look at how to implement that. That's also part of our goals, for healthy people, so that goes into the health part, to really start collecting data around sexual orientations and gender identity. So now we've set health, we set census, and also, in the United States, the CDC has the surveys, for school students K through 12, which is called the Student Behavioral Risk Survey for middle school and high school, and there are no specific mandate to include sexual orientations or gender identity, even though we know that LGBT students are 3 times more likely, to commit suicide, or to think about suicide, to use substances than, the general student populations. And so including those numbers would really help us to develop programs, to serve our students better, and also to reach out there to their parents, to help them, to support, the LGBT youth. And the last thing we need is more kids to run away from home because they don't feel accepted. Yeah. And that will only escalate the issues. Last but not least is, engage with the criminal justice systems to really count, the crimes victims, data is one set, the Prison Bureau of Statistics is another set. And also, if we really want to look deeper, even arrests and how they house transgender inmates need to be counted, because we know that being in detentions put LGBT people 21% more vulnerable and more likely for them to experience sexual assault. And so with these numbers and figures, we can come up with better strategies, to address them.
Absolutely. And I think too, what's always important for me to talk about when I have these conversations is that data collection is an intersectional issue. There's all of these issues that intersect when we talk about identity. And I think, what message are we sending to young people who are trans and gender nonconforming when we don't even count them? That when we suggest that their identities and their lives don't matter. In this context of Black Lives Matter, and we say trans lives matter and Black trans lives matter, how do we really begin to structurally implement that? I think counting us is a really basic thing to do, right? Just to count folks. Yes, Cecilia?
Exactly, Laverne. I think that's the important thing is we know transgender people exist. You've seen Laverne Cox and Orange is the New Black. It's the New Black. And and there are so many different transgender shows now on TV. So we exist. But if we ask you, like how many transgender people are there in your country, what would your answer be? Probably no one could give us an answer. It's because we're not counted. What that says about us, like when we can't even get a number of ourselves, is no one is actually acknowledging our legitimacy to exist. Yeah. Counting does that. Counting means that you say there are 5 chairs, I can count 5 chairs. You can count 5 chairs, but you can't count how many transgender men and women. That's a problem. And that's not just a problem here in the United States. That's a global problem. I did a kind of a scientific survey over the weekend. It's called Facebook. I just posed a question.
Facebook is very scientific.
And asked my friends, and from different part of the world, like in Sweden, which is one of the more, progressive country, they don't have us in the census. South Africa doesn't have us in the census. India, as you mentioned earlier, they just started to count transgender women, and they left out the men. It's the same thing with Malaysia, Indonesia, in many countries. This is not really a question about whether we're going to have laws to protect us. This is the first step. In order for any government to do a better job to serve their citizens, they need to know who their citizens are.
Absolutely. Absolutely. And I want to acknowledge, I've also been in communication with folks at the Williams Institute, and the Williams Institute in California does vital work around data collection and policy for LGBT folks. And because of their work, the California Health Survey is now asking gender identity questions for the first time, and there's actually annual surveys too. They tell me that when the work is done in annual surveys to begin to change this, then it can happen with the census that happens every 10 years. And I know some the folks at the Williams Institute also are trying to convene a congressional hearing on adding transgender people and adding a gender identity and sexual orientation question to the census. So I want to have this conversation to hopefully inspire folks out there to begin to think about what it means to count everyone and to make our lives matter, and then to do the work in so many different areas. It's not just the census. There's so many different surveys, governmental surveys, that really need to count trans folks. Also, we should also note that the National Center for Transgender Equality just completed the U.S. Trans Survey, the second one of its kind. So there's work that needs to be done, but the problem when we have, as Shelby alluded to earlier, when not-for-profit organizations are doing these surveys are not randomized, so we're not getting a real full idea of the population that's being affected.
And then on the topic of intersectionalities, I think that we talk a lot about these 2030 goals, and United Nations, UNAIDS has the new goal setting 2030 to be the year to end the HIV epidemic, and I think that's where intersectionality plays a big part, because no matter where you go, transgender women of color bear the burdens of being labeled a key populations, but you have to ask yourself, what the heck is the key populations? And what do they base that on? If you can't even count our existence, how do you provide services and provide support? And that's the reason why Transgender Law Center launched the Positively Trans surveys, to ask transgender people living with HIV, what their experience and what the gaps are in the legal landscapes and healthcare landscape. We just finished collecting our data also, and we'll be releasing a report shortly.
That's fantastic. I think it's important to note too that for years the CDC, the Centers for Disease Control, have in terms of HIV transmission, they've still failed to look at gender identity. Trans women are still being counted as men who have sex with men. So we're being literally erased from statistics around HIV transmission. And what we do know is that trans women, particularly trans women of color, seem to be at a very high rate for transmitting HIV. but we don't have the data. So there's so many areas in our culture that we can begin to just ask. And I think the question sometimes comes up, how do we ask this question about gender identity? And the folks at the Williams Institute basically suggested we could have a question that says, what was the gender you were assigned at birth, and do you identify differently from that now? What is your gender identity? And that can begin to give us some data around numbers of trans people, and then we can do follow-ups. We should also note that the Williams Institute is now also doing a survey with Gallup, where they are doing follow-up. They did ask questions for the first time, I think also in California, around LGBT, folks who identified as LGBT, and now of those folks, they're going in and finding out who identifies as T, and they're asking them more questions. So this is beginning to happen, but more needs to be done on this subject.
And I mentioned Facebook earlier as kind of like tongue-in-cheek, but it's really important also for our technology partners to start helping us collect that data. Facebook had changed the way they ask about gender identities, for
Custom
the
genders,
profiles.
yes.
With the custom genders, you can actually create your own gender, and I think that that's phenomenal. And I think that if we can see more websites that actually collecting data for marketing purpose, you never know, maybe some of us are like big spenders like Laverne, and you're missing out on it.
I'm fiscally conservative with my own money, not politically. Like just to be clear. Just to be clear. Okay. Go on. Do you want to? I think our time is up. Did you want to add something?
No, I just think that really data collection is the fundamental step that we can take to begin intervening in the violence that trans people are experiencing. Like, trans people's lives do matter, and the violence that they're experiencing is killing them. And it is all of our responsibility. It's not just the LGBT community, it's society as a whole. And the Census, as well as CDC, as well as crime victimization data, is the first step in addressing systemic housing, employment, discrimination, which leads to people's experiences with violence.
Absolutely. And I wanted to end, thank you so much, everyone. And I wanted to end with just the notion that there's so much talk about gender equality and education for girls. And it's so important that when we talk about gender equality, we also include transgender and gender nonconforming people all over the world in that conversation. So thank you so much.
Thank you. Thank you.